Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. My name's Solome Tibabu. I'm the host of the Expanding Access podcast, and I'm really excited to have Clay on with us today. We've got a lot to cover. Maybe just to get started, Clay, could you tell us a little bit about yourself, who you are, your role, and how you got into this space, please?
Sure. And Salome, it's great to be on with you. I appreciate you, hosting the podcast today. I've always had a passion for healthcare and started my career by enlisting in the Army out of high school as a combat medic, and had the goal initially to go to medical school and become a doctor. But I turned out to be a pretty good soldier. I ended up earning an opportunity to go to West Point and was commissioned as a Signal Corps officer or communications officer. While there, I deployed to Bosnia and to Kosovo, and I saw firsthand how mental health and physical health can intertwine for our service members. But I got out of the Army in 2000, and since then, I spent my career helping to deliver ways to improve how healthcare is provided, better systems, smarter tools. So I've worked in disease management and wellness, like hospital systems around inpatient quality of care management, and then cost transparency. But right now with mental health, it's the greatest need, but also where the greatest opportunity exists. So I feel really privileged to be working with some former colleagues of mine, the CEO and CTO of CredibleMind. We're building out capabilities to help drive improvements around mental health. I'm the Chief Commercial Officer. I oversee our growth, market strategies, and innovation.
Awesome. It's so great hearing your story and just how much you've accomplished. And so thank you for that. And of course, thank you for your service as well. And you alluded to just through those experiences, seeing a need, a huge need for mental and physical supports that really weren't on the market today. Can you talk a little bit more about why specifically now we need something new and different for physical and mental health?
Yeah, sure. I think as many of your listeners are likely aware, mental health demand continues to far outstrip the supply of clinicians that can deliver it. This was before COVID, and obviously COVID made it worse. People are still today feeling a lot more pressures that are driving need for mental health support. And we can't train clinicians fast enough to keep up with that demand. So those access challenges are still very real. We're seeing that play out in terms of long waiting lines for people to get care when they need it. Health plans and provider organizations are challenged with building high quality networks. But, many people don't realize they're struggling with mental health until they're in crisis. So we're a lot of times playing catch up and catching people at the end of that journey rather than being more preventative and proactive and finding them as risks are rising. Another big area of grit challenge is around stigma. We're making progress on it, especially with youth, but there's still a lot of challenges out there, especially in certain demographics like age populations, certain ethnic groups, and even in the military. I lived that experience in the Army. We didn't have a vocabulary for mental health when I was in. At best, we talked to friends or we worked out if we thought we had a mental health issue. We couldn't bring it up because we felt like we were jeopardizing mission. And then often we went to our favorite doctor, Dr. Jack Daniels. That's not often the best remedy. And that stigma in the military still continues to run deep. And then another challenge that we see in the market is when people finally do have the courage to kind of ask for help and seek help, we don't make it easy for them. The system looks a lot more like a maze to people when they're seeking mental health support than a map. So we're trying to help connect people to the right care and in a way that's easy to find and personalize to them. Even when we think about mental and physical health, it's still treated in silos. We're not really often looking at that whole person and how those things come together. And often mental health issues drive a lot of the physical health issues and vice versa. But the research shows that 3 out of 4 people, if they feel like they have something in a mental health need or something that they're unsure about and they're dealing with, they actually prefer to start with some type of self-care. They want to start on their own. And that's whether finding an app to sleep better, exercising more, or taking up a practice like yoga. But our system is set up by default to put people on medication or send them to therapy when that might not be what they want and or what they need. So we just saw the need to help provide better upstream tools to help people earlier in that process, to help support that more proactive journey, and then to help people find the clinical care when they need it. And also good news in the research is that self-care can be as effective as clinical care. There was a clinical trial that showed that patients with anxiety that were taking the drug Lexapro and those that instead used a mindfulness practice, they had the same clinical outcomes. So we're trying to bring these types of capabilities at scale so we can meet people where they are.
Oh, Clay, you've hit on so many important points, including, 5 years post-pandemic, we still have so many access issues, payers trying to grapple with the demand, providers trying to meet the need, and this idea that there still is not enough personalization happening in our space in 2025.
Yep.
And so something we've talked about before has been stepped care in behavioral health, making sure that folks are getting what they need in their specific situation. And in fact, maybe I'll ask you, what is step care? How does it ladder levels of intensity and how is it evolving today?
Yeah, great question. And step care just in general is a care pathway model that tries to match people with the intensity of care that's needed and provide it to them based on what they actually need at that point in time. And then modulating that intensity up and down based on kind of what's called steps. And step care for physical health, it's been around for over 40 years. It started in England, started out primarily around the conditions of hypertension and pain management, and then later was standardized around asthma and diabetes care. But generally, you start at step one with a clinical intervention. If you have more risk or you don't meet targets, you're stepped up to step two. But then if you get better and you meet those targets, you get de-escalated and step down to step one. So it's this continual modulation of the interventions. So for mental health, we're now have been starting to put mental health step care models into practice and scaling them, and really started kind of in the mid 2000s. That's where England had a pioneering role in doing that around how they've been delivering mental health care services. Here in the U.S. Veterans Administration put step care models into how they integrated primary care with mental health in the mid 2000s. And since then, those guidelines have continually been updated. But where we're seeing some opportunity to innovate is now that we have more of these digital tools, and especially tools that are more and content that's more evidence-based, you can put more capabilities at the front end of this step care approach that haven't really been there before. So as we think about it, at CredibleMind, we kind of start even before getting into a formal step one of therapy. We start with a step zero, with a digital front door to mental health. People are used to using the benefits for their physical health, but a lot of people, mental health is new. They don't really know what's available to them, how to navigate it. So just as a digital front door, we help to educate the member on their mental health benefits, help them find what's available to them, and then personalize navigation and put it all in one place, making it really easy for the user. But then as you need clinical care, clinical support, that step one is providing digital self-care, digital tools like cognitive behavioral therapy that's self-guided or behavioral activation types of tools. But then as risks get worse and you need to step people up, that's when you get into more steps 2 to 4. We have progressively more risk. You want to make the interventions more clinical. So you go into guided therapies like individual or group counseling. As risk is elevated from there, you can get into virtual psychiatry or outpatient or intensive outpatient care. But then for those that are in real clinical need and risk, those high risk, you want to put an inpatient or crisis programs for folks that have serious mental illness. But, one other thing I would say is that across these various steps in the step care model, there are supportive functions that are needed as well. It's the connective tissue that connects these different processes together. It's things like risk stratification, care navigation, care coordination. So at CredibleMind, we provide kind of smart screen solution that can help address understanding and triaging risk and then navigating people appropriately to care. But then Care Advocate as a tool that helps support clinicians and providers so that they can digitally assess and prescribe digital tools to people as they're stepped up and down these processes. So at a high level, that's kind of how we think about it and kind of where we fit in the process.
And just given the time in the market and the evolution of our space, this really does seem to be where payers need to go in order to make the best use of providers and resources today. It makes a lot of sense. Going back to one other thing that you mentioned is what are the access points for individuals to access care? And, we hear this phrase digital front door, but can you talk a little bit about what does a true digital front door for behavioral health look like and what it doesn't look like?
Yeah, great question. I'll start by saying what I think it isn't. And it's often what is provided to a lot of folks kind of as a start, right? As I referenced earlier, right now, when people get to a lot of sites or when they're looking for behavioral health services, it kind of feels more like a maze, right? There's a list of phone trees or fragmented sets of provider directories, and people have to go through many clicks to find something to get to what they actually want or need, or even not even understanding what they're looking for. So as we think of a true digital front door for behavioral health, we think of it as one that's just a lot more user-friendly and engaging from a consumer experience standpoint. It brings all of these resources together in one location in a way that's easy for them to find and navigate what they're looking for based on the ability to personalize what they're looking for and to navigate them. And further, it embeds some of these evidence-based digital tools around psychoeducation and digital self-care to help people find something right away. So they're not waiting that 6 weeks to a couple of months to get an appointment. They can understand their risks. They can get immediate help. And there's also a benefit to a digital front door being provider network agnostic, meaning, there are other vendors that offer digital resources for self-care, but many of them also offer clinical therapy. And then they're incentivized to navigate people just to their clinical resources. So when we think of a true digital front door, we think of it as being a digital first approach to help guide people to the care that they need in an evidence-based way, matching them based on their preferences and their risks to the care that's offered, but then doing that without bias. So you're really getting them to the best care based on their needs.
Super interesting. I'm thinking a lot about the self-care piece. This is, of course, something I've been excited about and involved with since I was a young person. That really brought me into the entire space, as being empowered to work on my own mental health as I can. Can you talk a little bit about why should that self-care sit upstream in a step care model, and how is it changing members' journeys and waitlists?
Yeah. So we've been doing a lot of work talking to clients, talking to prospects, talking to others in the market. We recently conducted a workshop with leadership from over 15 health systems and health plans represented. And a key theme for many of them was the burden of people showing up at the emergency department when they were in crisis, right? An overwhelming volume of people at clinics and the inability to understand the risks of each of those individuals and match them to the right type of care that they needed, and not catching people sooner. The system has just been too reactive. And as a result, it's catching people at that most dire point of need. So how do we move more upstream, and how do we identify and address those risks earlier? And we see self-care and these digital tools as a way to do that, or at least one of the ways that help do that. And we can do some of the ways we do that are doing monthly or quarterly digital mental health check-in. So we can automatically just send out, quick surveys that assess risk so we can understand people's risks and how it's trending over time, so that as risks are rising, you can intervene earlier and more quickly and with appropriate tools rather than waiting for them to get to that point of crisis. We also provide more supportive digital services as a wraparound capability during transitions of care. So if we're bringing in a clinical feed and we know that someone just got discharged from the hospital, we can send them proactive information around that. And so we have a partner that provides second opinion services for surgeries. And they saw that many people weren't showing up for scheduled surgical procedures that were very critical for their physical health. But because of the anxiety and stress around the surgery, they were canceling their appointments or not showing up for surgery because of the anxiety just around the procedure, right? And we also know that for many people who are recently diagnosed with diabetes, they're not adherent to their physical care plan because of the anxiety and depression around coping with the diagnosis. So one of the things that we're able to do, because we're upstream in that process with self-care, is bring in data from the plan, understand that someone was just recently diagnosed with an issue like diabetes, and then they may have had a history of some type of mental health issue before, and then proactively sending them a digital packet of information. and then directing them to our topic center. We have a topic center called Living with Diabetes because we know how important and how much of a comorbidity there is with many chronic conditions and mental health. So this provides a more comprehensive, and the way we think about it is a digitally integrated behavioral health approach so that we can not only serve people when they're at low risk and provide these digital self-care tools, but understand as they're getting stepped up and stepped down into mental health care, but also if they have comorbidities and have physical health needs that we can help complement, is providing that glue that stitches these different things together. So as a result, we see the ability to address low acuity issues, reduce that burden on the clinical system with our digital tools. It means shorter wait lists because people can get something right away, but also better access support for those people so that you're not taking up the seats of clinicians, people that have lower risk when they can, be satisfied with digital tools like we provide.
Yeah, really great examples. Now, Clay, let's talk a little bit about metrics and outcomes. Can you talk a little bit about what are you seeing in terms of what's important and what are some of the metrics and outcomes that could emerge from an upstream model like this?
So we've been able to aggregate the largest corpus of over 20,000 clinically validated evidence-based digital resources. So we have that in the form of a data lake and over 60 million people with paid access to our platform. So we're starting to see at scale how people are using these types of digital tools and how they're being leveraged as part of this care navigation process, whether it's to self-care and or navigating people to clinical care based on their need for that. And as a self-care navigation platform, we think about outcomes first as it relates to the user and their patient-reported kind of outcomes measures. But we also think about it, a lot of vendors, when people come to the site, they'll talk about engagement and talk about it in terms of the number of clicks on the website. We like to think about it in terms of, yes, we can engage people, but we also activate people on our platform. So we distinguish engagement from activation, where engagement can be people come into our site, they might be updating their profile information, or they might be searching for resources on the site. But the activated population, those are the folks that are taking actions that are progressing them more towards behavior change and appropriate care utilization. And those are activities like completing a resource series on our site. So an example of a resource series is around a lot of folks that have issues. They might search for something like breath work. But if you search for breath work on Google or TikTok, you're going to get 1,000 different things. You're not going to know what's good or what's not. We've packaged that into 5 distinct pieces of content that we can walk you through, short videos, podcasts that educate you on what breath work is, why it's important, and what the clinical evidence is around it, and how you can put it in a daily practice with something like box breathing. But hand-holding people through this type of digital content, we see that is a great way to engage them and keep them engaged, but also to activate them into their care management processes. And we're seeing of members who come to our site, over 40% are engaged over typical time periods, over 30% are activated, but also over 30% are taking an assessment on our site so we can understand that risk. And this is really important, especially for our health plan customers. Assessments are the most highly utilized piece of content on our site. People love to assess themselves. In our data, we show that people that are screening low to moderate risk, they're 77% more likely to stay on our self-care platform. But for those that are screening moderate to high risk, they're 70% more likely to opt into clinical care and be navigated to clinical care in a personalized way. So this means that we're helping people kind of self-select the right care for them at the right time. And our analytics can see these journeys unfold and help members make better decisions, but also help health plans and our customers make better strategic decisions around how they provide resources to their membership or patients to drive better quality and financial outcomes.
Wow, that's such a great example. Talking a little bit more about your work with plans, could you give any advice to payers in the audience looking to adopt more tailored navigation and holistic front doors? Any implementation learnings along the way?
Yeah, so we've done this now with multiple health plans across the market, but also in the public health market. We've learned a lot of best practices from public health implementations with health systems and directly with employers. And, in terms of implementing, especially when it comes to a health plan or any of these types of customer segments, what's really important is how do you communicate these types of services? How do you get people engaged? And how do you do that in a way that you have the data to actually personalize that journey? And so being able to do single sign-on so that we can have eligibility information and understand who's eligible for what. So we can have demographics information to tailor what type of content is surfaced to someone. And then to do proactive outreach and communications in a multi-channel way is really important. Some people will access our service through their desktop app, through their desktop device, some people through mobile, some people want to be texted. So being able to have multiple ways to do outreach and engagement, and then sharing data, whether that's ADT, admission, discharge, and transfer data that we can use to help personalize how self-care is done across those transitions of care, and or claims data on the back end to really understand and validate what are the outcomes that we're able to generate. So I think a lot of it comes down to, I would say first selecting a vendor that has evidence-based content and can help support you in these multiple ways. But then to make that most effective comes down to how do you communicate this to members and how do you share data to personalize that experience.
Such great points, because there are a lot of solutions out there. There's thousands of apps, but who has the evidence? And that's just critically important. Clay, if I could ask you one last question, where would you say we're going from here? How will digital behavioral health self-care tools advance in utilizing data and AI to enhance member experiences, outcomes, any of the above?
There's a lot of discussion, a lot of piloting, a lot of testing, and a lot of interest around what AI can do. And even when you say the term AI, people will think about AI in different ways, right? Some people think about it just in terms of analytics, or do you have predictive algorithms that can drive engagement and do things in a personalized way? And a lot of us are doing that already, obviously. But as you think about AI from a chat interface or LLM-driven capability, that is where a lot of the interest and a lot of the piloting is starting to happen. And the reality is that consumers are driving this a lot faster than health plans and health systems and others. And I'll just give a personal example. I have a son who, I got his permission to say this, but he uses ChatGPT as a personal coach and therapist, but he uses the voice feature on it. And I just heard him talking to someone one day. I thought he was actually talking to somebody, but on the phone, but he was talking to ChatGPT, and he was, and I was asking him how he was using it. At that point, he was just using it as a coach to help him with something, but he also told me that he uses it as a therapist, right? And when he feels like he might need that type of help. And so consumers are starting to do this, and there's research out there that shows that especially tech-savvy younger demographics are very open to using ChatGPT or LLM-based capabilities. But a lot of times those things often don't have the guardrails that are necessary to provide effective help, and definitely don't want to use it as clinical treatment, right? But it can be a supportive tool. So we're thinking about ways to embed that type of technology into our solutions, whether as a chat interface to help guide people to the right care, not necessarily be the clinician providing therapy. But also, one of the things that is really unique about this space is that we don't really understand how people think about and talk about mental health from their perspective. People don't talk about their mental health in terms of ICD-9 or CPT codes, right? They have their own vocabulary. So using LLM technology, as people are doing things like journaling on our website, or they're filling in worksheets, we can see how they're talking about their mental health experience and what they're asking for, what they need, what their challenges are. We can use that type of technology to personalize how we communicate with them, right? So that it feels more personal. It feels more like a personalized guide or coach versus just, an abstract digital tool. So I do see this type of technology continue to support how we personalize, how we deliver digital tools, how we better understand what people's risks and needs are, understanding it from their point of view, but then as they meet clinical care, appropriately navigating them and using these types of tools to provide more empathetic digital conversations is the way that I would say it. So I do think there's a lot of opportunity there. I don't think they're going to replace the clinician or the therapist, but can scale how empathy, insight, and guidance is done. So it feels more like how Spotify and Netflix treat you. They know your experiences and they make that next step more intuitive. I think that's some of the direction that we're going.
Awesome. And just thinking about the ChatGPT example, that just educating folks on, back to what's evidence-based versus what's easily accessible. But
Right.
that might be podcast number 2. So
Yeah,
really
right.
great stuff. Thank you so much, Clay. excited to learn more about the work you're doing and CredibleMind, and I encourage our audience to go learn more as well. Thanks so much for joining us today. Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.